Since the live feed a couple of weeks ago, we decided that there were still unanswered questions. So here we are today, a one-on-one interview with Dr. Parag Telang. Welcome.
Thank you. I'll be happy to answer some of the questions which we have been getting a lot of mails and a lot of inquiries. So let's start.
First question we have here, more detail about forehead contouring, hair advancement, and this thing called orbital shave. Why is it so important to a successful FFS?
There are two components in this question that has been asked. One is of course the forehead contouring and the second is the hair advancement. Let's start with the forehead contouring. There are three different types of forehead contouring which have been described, and we do from the orbital shave to a type 3 to something called as an overlay, where we put PMMA bone cement to contour the forehead. It's an individualized thing. I mean, it varies from person to person. If somebody has a very strong orbital rim, we do a CT scan and then decide if it's a type 3 which is needed. That's what we do.
So that's this heavy bossing. The type 3 is the one where you cut into it and you put 2 screws in.
Yeah.
I didn't need that. Mine was...
You did. And for the hairline advancement, there are two options really. Somebody wants to advance the hairline, either we take an incision which is right at the margin of the forehead and the hairline and advance the hairline, or we can do something called as an FUE, which is a follicular unit transplant, which you can do maybe 10 days or 15 days after your forehead advancement.
And this will hide in within that scar there?
That's exactly true.
So we only need to wait for that long before that thing. So would it not be more beneficial for the patient to wait and come back?
Yeah, you can always come back maybe a month or a couple of months later. Yeah.
You know, to see how the scar progresses, really.
Yeah.
So we've covered hairline advancement, the visible. So you've said we can either do the scar here, or we can do it behind and hide it within the hairline. And then the two options is either bring it forward surgically.
Yes, or do a hair transplant.
Or bring it forward with a hair transplant. FFS along with body contouring. Is it possible, and what about pain management?
Body contouring with FFS, it's not a big deal, but it depends on what exactly you mean by body contouring.
It was more referring to liposuction. The body contouring to take abdominal fat and place it in the hips and the bottom. See,
I don't do the conventional liposuction anymore. I perform only Vaser liposelection now.
Vaser. V-A-S-E-R.
Yeah, that's correct. It's something which works on ultrasonic energy. We can remove more amount of fat at one go. Fat which is aspirated with Vaser is more pure, and plus the pain is much less as compared to a conventional lipo. The pain is maybe 50% of a normal lipo.
I noticed there was a patient here that's just had it done, the body contouring with the hips and the thing. Hardly any bruising.
Yeah, Vaser doesn't cause much of a bruising and not much of pain. I mean, maybe 1 or 2 days of discomfort when you're turning in the bed or whenever you're getting up from the bed. 2 to 3 days, you're good.
I must admit, the only complaints that we had were from the garments, the compression garment.
Yeah, you have to wear them all the time.
Oh, that's the bruising and the pain itself, but it was the garment that seems to be the problem. But
no pain, no gain without pain.
What about rib removal?
See, I perform a lot of ear reconstruction surgeries for young children, and we remove ribs all the time. So it's not a big deal if somebody wants to have their ribs removed. It's just an additional scar on the chest which is concealed in the crease under the breast area, and yeah, we can do it.
How will a patient benefit from it?
If somebody has a broad chest, it's called as a barrel chest. So, and if you want a slimmer waistline starting from right here, then removal of the lower 2 or 3 ribs gives you a slimmer waistline.
Would that be together with the body contouring with the lipobasal?
It's a type of body contouring, but it's not a commonly done surgery. Plus, it will be a little more painful. Anything that you do on the bone is a little more painful.
Tracheal shave, that's another one. A tracheal shave, painful. Does it affect the voice? And where is the scar placement?
When it's done properly, it doesn't affect the voice. You have to know the exact level at which to stop when you're doing the tracheal shave, not to overdo it. And the scar, see, when we started doing the tracheal shave, the scar was way lower down on the Adam's apple. But now as the science has been progressing, so the scar also has been advancing. So now we take it somewhere closer to the jawline.
Tunnel down.
And then we do a tunnel from here to reach the Adam's apple.
Jaw and contouring, where is the incision made for this one?
That's a secret, isn't it?
jaw and chin tuck.
Can you show the incision that you have? Because it's inside the jawline. We don't take any incisions outside, so all the scars are going to be inside. They are intraoral incisions, and they heal just fine. They don't leave you with any unsightly scars, nothing that people can notice.
So, because it's more complicated to get to it inside, is this the nerves exposed along the where?
It's technically a little more difficult, but it's how we do it all the time.
Can a female nose be created from a very male nose in one surgery? And this thing called alloplasty, does it help?
Sure, it's as long as the patient is clear in her mind what kind of nose she wants. It makes my job that much easier. We always make a feminine nose based on also the ethnicity of the patient, because each continent has its own ideas and concepts about what looks more feminine. Europeans, they prefer a little slopiness on the nose. Indians and Asians, they like straighter noses. Yes, we can create a feminine nose in one surgery. LR-plasty is a very interesting procedure. If somebody doesn't want to do the whole rhinoplasty and what is bothering a person is only the flaring of the nostril, so when you smile it goes sideways, and that is what is the concern, then the LR-plasty is a 20-minute procedure where we take a small incision in the creases around the nose and we can reduce the width of the nose. Makes the nose slim down in the horizontal plane.
So, as far as FFS is concerned, the rhinoplasty and the alloplasty, they're very good tools to have, because you can create a smaller nose and a narrower nose all in one surgery. This is why it can be done in one go. Somebody has recovered from SRS or GRS or whichever the terminology is people use it, section reassignment surgery. How long is the expected recovery and how much?
See, I use a technique called as a penile inversion, where the skin of the penile shaft is used to line the vagina. I have typically seen that patients are walking comfortably on the third day post-operative. There is a pack which is kept in the vaginal cavity for a week. Maybe a week to 10 days is what you need to recover from this surgery. Of course, the most important thing after the surgery is the vaginal dilatation. So we give you a set of dilators and a lubricant jelly, and you are taught on how to dilate the vaginal cavity. So that is the most important part. You need to do the vaginal dilatation at least for 3 months after the surgery.
Well, I'll have to cover. We'll cover that a little bit more when I get there. So this is the end of part 1 of our interview with Dr. Telang.